Hi, I'm Dani Gasparini, and welcome to this segment of Penn Voice. I am joined today by Brianna Evans, who is with the Office of Diversity and Equity within the San Mateo County Health System. Brianna, welcome. I think you're a first-time guest of Penn Voice. So very excited to be talking about community health, something very specific. We all know that as February is approaching, it is Black History Month. So one might say, what is the San Mateo County Health System and the Office of Diversity and Equity doing with Black History Month? But there's some real important health issues that come with our cultural and our African-American population. Just tell us about what you're doing.
Thank you so much for having me on today, Dani. I'm really delighted to be here. We are, as you said, I'm from San Mateo County's Office of Diversity and Equity, where we're focused on making sure that everyone in San Mateo County can enjoy mental wellness. That looks like a lot of things for different people. We know that people experience stress due to things like the housing crisis. There's anxiety and difficulty that comes along with that, and due to other things like bias that occurs in medical care, so bias from providers. So we are, as an office, always thinking about how we can make sure that our residents feel well in our county. And this month in particular, we're thinking about our Black residents and how we can advance solutions that really make San Mateo County feel like home.
So one of the things that you mentioned there are, from a cultural standpoint or an ethnicity standpoint, that there are certain diseases or health issues that come with part of that ethnicity. You had mentioned that with Black History Month, we want to ensure that we're ensuring that our population really is getting access to mental health. We sometimes don't feel like, unless we're in an acute crisis, that there's really no place for us to go to get information in a proactive way, or maybe for someone else. But there are some things that you're specifically trying to do within Black History Month in February. So tell us about those programs.
Sure. So briefly, our office is thinking often about stigma. We want to make sure that everyone is able to get the care that they need when they need it. But stigma is a huge barrier in the Black community and in other communities. When people feel like talking about a mental health challenge or a substance use challenge will result in other people calling them crazy or thinking that they're druggies, they don't come forward and they don't ask for what they need. So one of the programs that we run is called the Health Equity Initiatives, which are focused in different communities in San Mateo County. There is one specific to the African American community called the African American Community Initiative. So that initiative puts on events and offers community education so that people know what mental health is and are able to understand when is the right time to come forward and ask for help.
And you know, it's the difficulty with mental health as well. It's one size does not fit all, right? So we all face different moments of crisis or different moments of question. We all wonder where we go for access. So it's, you know, if you break your leg, you know, head over to the emergency room. So it's one of those things that I imagine that your office is continuing to try and make sure that people know that at whatever spectrum of the continuum, that they know that there is a place to go for question and or direct counseling and services. So that's going to move us on to our next question. And you create a lot of community-based health information and outreach programs. So tell us about some of these initiatives so that we get an idea, our viewers get an idea of some of the things that you're touching on that may in fact make someone think about someone in their family or themselves and, hey, I could use a program like that.
Of course, I appreciate that question. Starting from, you said that people have different needs. It doesn't look the same for people. Our office is focused on equity rather than equality. And briefly to explain what that means, equality is about everyone getting the same thing, and equity is about everyone getting what they need. Right, exactly. So our range of programs are really targeted towards communities with that understanding that we want to get people what they need. So for instance, the Chinese Health Initiative has a range of programs that are focused in Mandarin so that people that need services and maybe are unsure about how to talk about what they need or are uncomfortable labeling it in the terms that Americans often use, can find a way to get to services. At the same time, services in Mandarin are not necessarily helpful for the African American community. So we have a different focus there. And it really is about bringing community members in, finding out what they're interested in, and then trying to produce that for the community.
And you had said a word in the beginning, which we don't oftentimes think about with behavioral or mental issues, and that is stigma. And so we all come with our own set of stigma to begin with, either culturally based or individually based, ethnic based, or just our own, who we are as an individual. And so we're going to access care or information in different ways, whatever's most comfortable for us. So I like the idea that you're telling us that we're going to try and remove the language barriers, we're going to try and remove the access barriers to make it equitable for whatever my needs might be. I wish we had more than 10 minutes because we could really get into some very detailed discussion, because I would imagine taking an individualized approach to one's care creates a very complex environment from a delivery standpoint, and you wanting to be able to reach as many people in an individualized manner. So tell us, what are some of the unique challenges that our community faces today? We heard a little bit about the cultural and ethnic kind of challenges, but what on a broad base are you seeing today?
Sure. So San Mateo County's Black community has been shrinking over time. There's a really strong history, a lot to celebrate in San Mateo County's Black community, but also the housing crisis and the increasing cost of living here, as it affects everyone else, is also affecting African Americans.
Right.
So a lot of people have left. So there are family ties that are broken through that. There are stressors that come along with looking for housing and that sort of thing. We also see a disparity in incarceration rates for substance use. Although African Americans use substances at rates similar to other communities, they are more likely to be incarcerated for the same infraction and for longer times. That creates a kind of stress that is not often very well studied.
Right.
So we think about the individual that's incarcerated and what happens to them and whether they get substance use treatment while they're incarcerated. And we also think about the family members that are left behind and what happens to a family that has perhaps a breadwinner or just a loved one that is taken out of the picture for a long time. So those are huge stressors.
You know, I would have never thought about something as really tactical as the housing crisis to really place stressors on whether it is the African American community or Latino population, cultures that are typically very family-based. So same generations of individuals reside in one community. So aunties or grandmothers or whomever are all the caregivers within that family, right? So now you have one segment or one cog in that wheel that has to move out because of the access to housing, and now you've lost that whole family resource, that fabric, to a culture that's not necessarily used to reaching out and saying, what are some of the government services that I have access to figure out childcare or to figure out even access to health care. So it's interesting that I wouldn't even have thought about that. So thank you for bringing that up. And one of the last questions that we want to make sure that our viewers see is, how do people learn more about it? Because again, we can talk about very specific subjects here, but there's 2 hours more of conversation that we could have about the various programs and challenges and issues that people come to you for help.
There's our website, the San Mateo County Office of Diversity and Equity website is smchealth.org/HEI.
And in case people didn't get that, it'll be up on the screen.
Perfect. So you can find more information about the health equity initiatives, which are our main outreach and community engagement program. But we also have several events that happen during the year. One of our community partners is putting on an event called Off to a Good Start this February, on February 24th, where people can come out, celebrate good health in the beginning of the year.
So we have just about 30 seconds left. What's that kind of one message that you want to ensure that our viewers know about your Office of Diversity and Equity?
Wellness means a lot of things to a lot of people, and we need to make sure that we are paying attention to every part of our community as we try to step forward into a whole and healthy community.
And I really appreciate the fact that you've then created resources for people in a very individualized and yet creative manner to ensure that people are getting access to the information. And we should say that your programs and services are free to people. So the issue of pay for service is something that they won't face when they look you up for programs and support and resources to perhaps get additional support. Well, Brianna, thank you so much for coming. We really appreciate always when the Department of our health and recovery services within the San Mateo County health system comes to chat with us about making our communities well and vibrant and a wonderful community to live in. So thank you.
Thank you, Dani.
And we'll see all of you guys next time on Penn Voice.